Hello everyone. Today we'll be talking about mandibular nerve. Okay. So the mandibular nerve is the third branch of trigeminal nerve, which is a mixed nerve. So the trigeminal nerve is actually giving ophthalmic, maxillary, and mandibular nerve. Ophthalmic and maxillary, these are your sensory, but the motor nuclei fibers are actually given to this V3. That's why this is your mixed nerve. As you can see, the sensory root and motor root are there, and that is forming the trunk of the mandibular nerve. So first we'll be focusing on the trunk. The first question, okay, before that, remember mandibular nerve is known for supplying the, giving the motor supply to all the muscles of mastication, But they will ask the question, which muscle is directly given, the supply is given from the trunk. So this is your medial pterygoid, okay? So you can appreciate that this is the trunk, and this trunk say directly the medial pterygoid is given. This trunk, after formation, it will pass through one foramina, that is the favorite foramina of oval, through which the other structures also pass, and the mnemonic is male structure, that is mandibular nerve, ascending meningeal artery, okay, then lesser petrosal nerve, and emissary veins. Once this thing is done, then it will supply to the medial pterygoid, and the same branch will actually give supply to the tensor vallipalatini and tensor tympani. Okay. Here we have foramen spinosum, which is just after your foramen posterior to the foramen oval, and through which your chief neurovascular structure, that is nervus spinosus and middle meningeal artery, they are passing. This nervus spinosus is also a branch from the trunk of mandibular nerve. So from the trunk you have branch to medial pterygoid, and this is the nervus spinosus. After that it will pass lateral to the otic ganglion. The trunk will pass lateral to the otic ganglion, and that will be divided into anterior and posterior division. Okay. The anterior division is mainly motor. Why? Because it will supply rest of the muscles of mastication. That means whatever left here, your lateral pterygoid, okay, temporalis, and your masseter, these three muscles will be supplied from the anterior division. After that, this nerve will be continued as a sensory branch, and that will actually pierce your cheek and supply the skin over the cheek, okay, and then it will pierce the buccinator, but it will not supply the buccinator because it is the sensory nerve. After that, it will go to the mucosa of the cheek and supply. So it supplies the outside skin and inside the mucosa of the cheek, but not the buccinator, because buccinator is supplied by your facial nerve. Okay. Coming to the posterior division, the posterior division is important because from posterior division the branches are early branches: auriculotemporal, lingual, and inferior alveolar. From auriculotemporal you can assess that auricle and temple, so the skin over the temple and the upper two-thirds of the auricle are supplied, along with the nearest joint and nearest gland, that is temporomandibular joint and temporomandibular joint and parotid gland, this is supplied. Then you have the lingual nerve. This is topographically related to the submandibular ganglion. Topographically relation means this is the main nerve which is passing, but when there is a nearest ganglia which is present, this nerve is going, and without relaying there, it is actually coming out of the ganglia. That is topographical or anatomical relation. But functional relation means some nerve is going and relaying there, and the information from this nerve is actually taken care. It is actually taken by this topographic nerve, and it is related to the distal organ. That is what is functional nerve. Okay, and here it is topographically related. And we all know lingual nerve is supplying the general sensation, that is touch, pain, temperature, the anterior two-thirds of the tongue. After that, alica eye is there. Eye is inferior alveolar nerve, which after forming will actually pass through this mandibular foramen, which is present over the medial surface of the mandible. Okay, through which it will pass through this canal and will supply the lower jaw. After that, it will be coming out as a sensory branch, that is mental nerve, which supply the skin over the chin only. But before actually going through that, it will supply motor innervation to mylohyoid and anterior belly of the digastric. Okay, this is in short. Now just remember कि muscles of mastication तो supplied by mandibular nerve, all know, but there are also four muscles other than four muscles of mastication. There are other four muscles which are not muscles of mastication but still supplied by mandibular nerve, and these questions were asked. From the trunk of the mandibular nerve you have the tensor muscles, and from the inferior alveolar nerve it is mylohyoid and anterior belly of the digastric. It is the mylohyoid and anterior belly of the digastric. Thank you.